If you've been to physical therapy, done the exercises, maybe even tried dry needling, cupping, massage guns, and yet pain still comes back, I've got news for you. You've been lied to. Maybe not intentionally, but what you have been told about pain, how to treat it, is outdated, incomplete, and in many cases, flat out wrong. In the next few minutes, I'm going to show you what they're not telling you and what you can do to finally understand and eliminate chronic pain. Hi, my name is Armando Cruz, and for the past 20 years, I've been helping men and women just like you who are high performers, who are athletes, who are committed to excellence, get out of pain and get back to doing the things that they love. Let's jump into it. Most physical therapy approaches pain as a purely biomechanical problem. Your shoulder hurts, they'll stretch, strengthen, ultrasound the area. Your lower back hurts. Well, here's a core routine for you, maybe 3 sets of clamshells. But here's the truth. Pain is not about tissue damage. Pain is an output of the brain. So pain happens in the brain. It is a full body, full life experience. You can have torn muscles or gotten hurt and really not have a lot of pain. Or you can have no damage at all and yet be in agony. So why are we still treating pain like it's only about fixing the body when it's so much more complex? Pain is influenced by 4 key dimensions or 4 levels. Level 1, physical. We're talking about the muscles, the joints, the tissues. Level 2, emotional. Stress, anger, grief all affect pain and how we feel. Number 3, our mental state, our beliefs, our identity, our past experience, all contribute to the experience that we have within the pain that you're feeling. And number 4, the spiritual, where we dive into more of the purpose, the connection, the alignment. Most therapies focus only on that first level. And that's why progress is often temporary. You're not just a machine with worn parts. You are a dynamic, adaptive being. We need to stop chasing symptoms and start understanding systems. Your pain isn't random. It's intelligent. It's trying to tell you something. Here, let me illustrate. Here's the vicious cycle that most people get stuck in. Number 1, your pain gets flared up. Number 2, you rest or you go to therapy. Number 3, guess what? Feels a little bit better and you go back to doing some of the things that you were doing before. Number 4, pain returns. Number 5, you get discouraged or, and this one really lights me up, is when, oh, it's just your age. Guys, because you're getting older doesn't mean you should have pain. Anyone who tells you that that's the reason that you're having pain is not practicing solid health principles. They're being lazy. Okay. Number 6, you start avoiding the movements now. Number 7, more pain shows up. What breaks the cycle is not just exercise. It's changing how your nervous system perceives safety and movement. So pain equals protection. Healing equals safety. Let me share what actually works. We need to shift from the fix me model to the teach me model, integrating multiple modalities to rebuild a resilient body, a resilient brain, a resilient mind. So let's tap into the nervous system regulation. Let me just share a quick story. So we have Sarah, right? Sarah is a marketing director who came or went to physical therapy for a back spasm. They treated her in a traditional way and it helped temporarily until her next big presentation. When anxiety spiked up, her back pain soared. When she came to us, we dove down this nervous system panel. We dove down really resetting that nervous system. We did that breathing protocol. By her integrating that, not only did it calm her nerves, it helped to bring her the tension of her nervous system back down. And now she could be up on stage with no pain and no back spasms. Why this matters is because when your nervous system is really sensitive, it amplifies the pain signals. So here's kind of like the fix. Here's what I would recommend. This is a quick one that I want you to take with it. Daily breath work, like box breathing, where you'll breathe in for 3 seconds, hold for 3 seconds, exhale for 3 seconds, hold for 3 seconds. And you keep going all the way around, box breathing, 1 rep at a time. Why this matters? When your nervous system is sensitive, it amplifies the pain. And so what we can do about it are a few simple things that can help engage your parasympathetic nervous system to bring down the tone and allow the brain not to feel like it's under attack. So you can do breath work like box breathing, where you'll breathe in for 3 seconds, hold for 3 3 seconds, exhale for 3 seconds, hold for 3 seconds. You can add body scanning where you walk, where you're visualizing your entire body and realizing or telling your body to relax in these different spots. You can go with cold showers to engage the parasympathetic even that much more. Again, the idea of all of this is bringing that emergency state back down so the nervous system feels safe. Number two, movement repatterning. Let's talk about Tony for a second. Tony was an avid hiker, but he started having knee pain and compensated by shifting his weight to the other leg. Soon both knees hurt. He relearned the simple squat with a dowel rod for alignment. He went to traditional therapy and they taught him how to squat. He got a little stronger, but the problem was the pain returned. And as the pain returned, we had to reprogram everything. So when Tom came to us, what we ended up doing was helping to reprogram the compensatory patterns, right? So he had shifted all his weight to one side, but they hadn't really reboot that pattern. And so when we're looking at something like this, practice slow hip hinging, shoulder circles, then progress to resistance bands on uneven surface. So now you're reprogramming the movement, but in different scenarios, and you're doing it in a safe manner. Number three, emotional processing. So let's talk about Emma for a second. After her divorce, her shoulder pain got really, really bad. No doctor could really find a cause. There was no structural damage. Here's what did make a difference. When she did come to us, what we did was we kind of evaluated what was going on, and we found that obviously a divorce is a huge life event. And once we addressed that, hey, this is the elephant in the room that was literally putting a load on her. We coached her to doing some of the breathing exercises. She started journaling every day about the grief that she was having, the struggles she was having, and then brought in some gratitude along with that. Over the course of 1 week of her doing that consistently, her shoulder tension went away, her mood lifted, she didn't have that tension. Again, here's why it matters. Emotions create physiological tension. When you are carrying the burden of all those emotions and they're trapped, it becomes like a backpack full of weight and it's just weighing you down and creating lots of tension. So an easy, or not an easy way, an effective way that you can help with that. Journaling prompts, guided imagery, some somatic release, like some gentle shaking. All of those things help, again, release the emotional tension. Number four, identity shift. So this one's an interesting one. So Jack was a basketball player, right? Jack had a knee surgery and it basically sent him into retirement. And, whenever you've been doing something for a long time and now you're basically forced out of that role, it's a hard switch. So when he switched, he needed to switch from professional athlete or all-star athlete to now becoming an all-star at recovery, an all-star at healing. So we started with small targets, with some light jogging, with getting up from a seat, getting up from the floor. We started with just shifting his mindset about how can I reframe the I am statement. I am a powerful healer. I am a strong athlete. I am someone who is consistent and dedicated, right? So we started using these I am statements mixed in with these micro steps to help build them back up. Because again, here's why it matters. How you identify will affect your pain because pain reinforces the symptoms. And then the symptoms, it's a vicious cycle that eats away and grows like that snowball effect. So what to do about it? Reframe your I can't to I am. And set these micro goals. Number five, community and purpose. So look, this is the last one here. And I want to share the story of Claire because she had this chronic neck pain. And at the beginning, there was nothing that really seemed to help her when she went to traditional physical therapy. But upon talking with her, she worked at home, okay? She really didn't go out much. So she didn't have a community. So once we started talking with her, we started getting that deeper understanding of what's going on. We asked her to look for some group activities that she could do that weren't intense, but that she would enjoy. And she found a Tai Chi group, which is amazing. And she absolutely loved it. She started bonding with that community. And that community actually helped that interaction with other people that were interested in the same thing that she was. And in the process of that, they were interested in seeing her progress. All of a sudden made all the difference. Again, when you're looking at community and purpose, the reason it matters is connection and purpose buffers against pain. When you know that people people want to see you succeed, when you know that people just want you, all of a sudden your mood, your cocktail of emotions shifts. So again, join group class, volunteer, integrate movement into community activities, and you're going to notice a big shift in your healing. So here's the wrap up. Number one, here's what I want you to do. Self-assessment. Rate your pain on a scale of 1 to 10 in each one of those dimensions that we talk about, in each level, the physical, the mental, the emotional, and the spiritual. Start where the highest score is and see, hey, how can I bring it down one number? Your mental, or let's say your emotional is at a 9. What could I do today that would bring it down to an 8? So what's one thing you can do? And the same thing, don't try to go from 9 to 1. Just drop it down 1, because those little things make all the difference. Just chipping away starts creating progress, starts creating momentum. Number 2, daily rituals. Pick one 5-minute nervous system practice we talked about. Do it daily and log it in. Check it off. Make sure it gets done. Daily rituals create safety and stability for the brain. Number 3, a movement challenge. Select one movement pattern. Practice intentionally and mindfully every single day. It doesn't have to be long, 5-10 minutes, but move your body in a way that makes it feel better, more energized, and make sure there is no pain attached with it. Number 4, do an emotional check-in. Schedule a weekly emotional scan with journaling, or go to traditional talk therapy. It helps to get it out here so you're not carrying it with you. Number 5, the narrative shift. Create I am affirmations, I am statements, because I am is an identifier. When you say I am weak, your brain starts processing that. But if you say I am an ultimate healer, I am strong, I am consistent, all of a sudden your brain has to align with that I am statement. Number 6, community connection. Find and attend one group event this week. If you're still struggling with where you belong, having a group that has something that you're really into, I would highly encourage this. This is such a big thing that people often skip over. Having a tribe, having a community, having a group is the way we were designed to be. We are mammals. We are a group. We are better when we are with others. Listen, this is just the start. For deeper support and a personalized roadmap, schedule your free pain profile analysis at cruisecountry.com. If this helps shift your perspective, subscribe, share with someone struggling, and comment below which story resonated most with you and which step you'll start this week. Remember, pain does not define you. Together, we can rewrite the story and reclaim your life pain-free.